Welcome to another episode of my video series, People Who Make a Difference. I'm Robert Simmons, and today we're with my doctor and my friend, Dr. Bill Warnock of the Champlain Center for Natural Medicine in Shelburne, Vermont. Welcome to the program, Bill.
Well, good morning, Bob.
Good morning. It's nice to have you.
All right, so we're going to talk about iodine today.
I'm looking forward to this one.
Good. We've already talked about in the series vitamin D, vitamin C, and omega-3 fatty acids.
And these are all members of the 5 supplements that you've said that just about everybody needs.
That's correct. And iodine as number 4 is probably the most controversial. And there's some good reason for that. So if we explore iodine, it's in the chemicals called halogens, and that includes chlorine, fluorine, bromine, and iodine. And we're pretty familiar with the others, and we have quite a few of those in our environment and our food. And iodine is relatively rare compared to the other 3.
In our food, you mean?
Yeah. Now, iodine doesn't come from many food sources. In fact, about the only food source it comes from is seaweed.
All right.
So as Americans, we do not eat much seaweed. And iodine deficiency results in a condition called a goiter, where the thyroid gland, which is right at the base of the neck, swells up. And it used to be that a lot of people in their appearance would have this swollen lower neck, and you can still see that among some people to a slight degree. In fact, sometimes I'm watching a movie and I'll look at somebody's neck and I'll say, oh, they need some iodine. But iodine was put in salt to help with that situation 100 more years ago. And it was also put in flour products. But it was replaced by bromine a couple of decades after that began because it was so much cheaper.
Oh. Was it put in flour in the first place for health reasons?
Exactly.
Okay.
And it's a preservative as well, so it was helping with 2 aspects. So when you think of iodine, what uses do you think of?
Well, I mean, you think of it as a disinfectant if you get a cut. That's the first thing I think of. Exactly.
So iodine's been used to put on wounds for disinfectant, and it still is. There's different forms of that. And when people go camping, they put iodine tablets in the water to kill bacteria.
Oh, I didn't even realize that's what was in those.
Exactly. So
okay.
That's one property of iodine, is that it's antiseptic. Another use our body puts iodine to, and probably the one that gets the most attention, is thyroid gland. And
right.
The thyroid hormone is composed of about 99.9% iodine. So it's just 4 iodine molecules bound together by a carbon. It's got a hydrogen involved in it. But that's what thyroid hormone, thyroxine, is made out of. So if a person takes in a small amount of iodine, it's all going to go to their thyroid gland.
Because that's where it's needed first in the body's priorities, you mean?
Exactly.
Okay.
And the body uses it in other places, and these uses are mostly ignored by other doctors, and they only think of iodine in terms of thyroid, but iodine occurs in high amounts in women's breasts and men's prostates, and helps metabolize estrogens.
Mm.
So the Japanese, who have a 100 times higher iodine intake than Americans, have a much lower rate of breast cancer, about 1/7.
Wow.
And men in Japan have a much lower rate of prostate cancer and prostate disease in general.
Wow. I didn't know that fact at all.
So when Japanese people who are eating a traditional Japanese diet high in iodine, in other words, high in seaweed, move to a Western diet, those cancer rates and diseases of the prostate and breast go up to the Western American levels.
Oh, wow. So there you can see that it's not just a genetic difference.
Exactly.
Gotcha.
Another use our body puts iodine to, and this goes along with iodine tablets and water a little bit. There's a process that occurs in our small intestine called the migrating motor complex, which is basically a process that occurs between meals when the intestines, the stomach and small intestine should be emptied, that cleans it out, sterilizes it, gets rid of the bacteria and whatever food substances are there. And if a person has ample amounts of iodine, iodine concentrations in that process are really high.
Mm-hmm. Does that affect the getting rid of the bacteria aspect of it?
Small intestines, unlike the large intestines, have very little bacteria in them, and iodine can help maintain that healthy situation in the small intestines.
Wow.
So these things that iodine does, it helps with thyroid. Well, it's needed to create thyroid hormone. In fact, thyroid hormone is all iodine, basically. It helps with digestion, and it helps metabolize estrogens in the body.
That's a lot. And I mean, I know from personal experience, and obviously you know I've had it because you treated me for it. I've had thyroid issues, and you put me on iodine for that reason.
Now, this is where the controversy comes from, because Americans have such a low intake of iodine. If they have a high pituitary hormone called TSH, which occurs when the body wants the thyroid to produce more of its hormone, then taking iodine can put a person over the top, because the body's used to scavenging all that little amount of iodine in the blood. So you could say there's a high pressure gradient to get the iodine into the thyroid, and that's really what a goiter is too. The thyroid expands in order to capture more iodine out of the blood.
Oh, uh-huh.
So anyway, when a person has a high TSH, meaning, of course, low thyroid, and they flood the body with iodine, those levels can go way too high. So that's one thing a person has to watch out for. So it should be monitored by somebody who knows what they're doing, or else a person can get into trouble with that. And
so people don't just go take iodine on their own necessarily. They need somebody to monitor.
A person can take it safely in fairly low amounts, but nothing close to the Japanese level, which is about 15 milligrams a day. And the average level in the United States, just from salt, and well, that's really the only source, is about somewhere between 80 and 200 micrograms, which is 1,000th of a milligram.
Right. So, yeah, that's a huge difference in dosage.
the thyroid gland itself will use up the first 300 to 400 micrograms of iodine. If you want these other benefits, I think about 1,000 micrograms or 1 gram a day is a safe dose for most people to take.
Now, did you say 1,000 micrograms or 1 gram a
or
day?
1 milligram. I'm sorry,
okay.
You caught me.
Yeah.
All right.
I
Good.
want to make sure that they got it right.
All right. Well,
Yeah.
good thing someone's watching out for me. Now, iodine doesn't stay in the body very long, so you really can't test iodine levels well. It's excreted quite rapidly through the kidneys, and you can do a 24-hour urine test to see how much is excreted, but that's not a true picture of the intake, because if a person's iodine deficient, their body's going to be absorbing more iodine, and
Right.
if they have plenty of iodine in their tissues, they're going to be excreting more of it. So that's more of a reflection of what that test shows. So it's not a very good test for most people to do. But it does indicate another use of iodine, and that is that it can, because it's excreted in the urine, it can be helpful for chronic urinary tract infections.
Oh, of course, because of that antiseptic property.
Exactly. And I recently came across a study, because in Vermont, we're treating a lot of tick-borne illnesses, that when iodine is added to doxycycline, the doxycycline becomes much more effective in killing off the Lyme spirochete in the body.
So for Lyme disease, that chemical you mentioned is an antibiotic?
Doxycycline is the typical antibiotic for the treatment of Lyme disease.
Got it. And so the iodine increases its effectiveness.
Exactly.
Okay. That's important for a lot of people, I think, to know that.
It is. So iodine has a lot of uses, and unfortunately, a lot of doctors recommend against iodine, and there's reasons for that, but if it's administered correctly, it's safe and can be effective for a lot of health reasons, and make a person generally less susceptible to many diseases and in general more healthy.
I see. Well, I can testify that since I started taking it, I've had quite a few years of good health. I mean, I don't suppose it's all about iodine, but I can't see it's done me any harm either.
Well, exactly.
Yeah. So have you said everything you want to say this time?
I think so.
Okay. Thanks, Bill. I appreciate this, and I hope all our viewers have learned something they didn't know about the benefits of iodine.